Hi, good evening, everyone. I'm Dr. Mahesh Nair, founder and director of Nipentak Aesthetics, Nagar, Cochin. And today I would, one second, I'll just adjust this frame a bit better. Yeah. So today we would like to discuss the topic of breast reduction. And why this topic? Because frankly, many are shy to speak of it, and there are many doubts in women's minds. And mainly they come for the consultation of a tummy tuck, but it is frankly the breast that is giving them a problem, and hence the consultation gets diverted to a breast reduction than a tummy tuck. So generally, this procedure comes as a part of the mommy makeover, bargain. Not bargain exactly, but it's like the mommy makeover package, wherein your whole body can be recontoured back to somewhat your pre-pregnancy state, and it is a very fruitful surgery, frankly. So coming to breast reduction per se, yes, why do we need breast reduction? Because sometimes these excessively large sagging breasts can lead to physical problems in many women, like a lower, lower neck pain, upper back pain. These are all real issues. Sometimes when even they sleep, the excessive weight on the chest can make them feel breathless. Many of my clients have complained of this issue, and it may sound outrageous to you. You may not even end up believing it, but all these are very practical issues being faced by women day in and day out. And sometimes they can't wear clothes of their choice. They get embarrassed to perform certain activities, maybe even just a simple dance. It can be embarrassing. So this is mainly the reason why breast reduction is such a fruitful, it's such a rewarding surgery. And moreover, it is a perfect blend of art and science. And not like art and science, sorry, that is obviously there, but it's more of a blend of aesthetic and reconstructive work. Why? Because breast reduction has to be done, to give you relief, to give you your form or your function, and everything else back, just like how it was before your pregnancy, before your lactation, or maybe sometimes, even congenitally or at birth itself. You might be genetically prone to having large breasts. Someone in your family must have had that. So those girls generally by adolescents, they generally have larger breasts. They cannot participate in sports activities. They get embarrassed. They are often teased, or they are it's kind of embarrassing for them. They can't express themselves. But yes, if they do, parents should not take this issue so lightly, and they should seek help or attention. And who better than the cosmetic plastic surgeon who deals with these surgeries day in and day out? So it's not like that you go to an onco surgeon to get a breast reduction done. They do mastectomy or removal of breast tissue, whereas we do cosmetic breast reductions, wherein your breast becomes like before, I mean, either like pre-pregnancy state or of a smaller size in a more aesthetic manner. So what you get are perkier, firm breasts which are lifted. So breast reduction and breast lift kind of go hand in hand. I'll come to that a little later. What is the exact difference between the two? Because many of you all have asked me that particular question. So coming to the basic issue, like why you should get a breast reduction done, I just enumerated the reasons for that. In fact, most of my clients these days are younger, I can say unmarried women who are more conscious about the size of their breasts, and that they want to live a more easy-going lifestyle. Like, they want to fit in to clothes of their choice, be a little lighter, so on and so forth. So it is, of course, the legal age for performing the surgery is about 18, and all that is being kept in mind. There's no doubt about that. It's not that I operate some very adolescent females who are underage or something like that. But even in those cases, suppose if the parents consent or the guardian consents that okay, this girl is undergoing psychological trauma because of large breasts, and the way she has to live with them, then in that case, even a surgery can be considered for sure. There's no doubt about that. You need a consent of both, and of course, not a adolescence or late adolescence, somewhere is where the growth of the breast has been completed. If the breast growth is not complete, then we wait, and that generally happens by say around 18 to 20. So it's best to wait for the maximum proportions to have reached, and then you go in for this surgery. Some have even asked me whether breast reduction is permanent or not. Well, in a sense, it is a permanent surgery because you get rid of excess skin, fat, and breast glandular tissue as well. The glandular tissue is mostly not going to come back, but fat can. So if you land up gaining a lot of weight, say like a fluctuation of 4 to 5 kilograms, then definitely some of it can get deposited in the breast as well, because that's a natural site for fat to get deposited. So genetically also we are predilected to certain areas of the body where we can accumulate more fat, say the thighs or the butts. Some people are more prone for upper body fat, torso fat, some have pear-shaped figure. So all these matter a lot in redistribution of fat when you gain weight. So primarily, yes, it's a long-lasting, near-permanent result. Aging, of course, I cannot stop. No one can stop. So with age, definitely breasts are gonna sag, but that does not mean that they're gonna enlarge and then sag. So there's a difference between that. So I think I've answered two important questions there, which I got asked very recently. Do I operate on younger unmarried women? Yes, I do. And do breasts grow back after reduction surgery? Well, mostly they don't. They can't, because you're removing the gland from there. Another issue that sometimes we have found is the sagging large breasts can have accumulation of sweat underneath them, abutting the chest, where again fungal infections can grow. So that leads to intertrigo and itching, scarring, and kind of cosmetically unsightly. So yes, again that's a practical reason for getting a breast reduction surgery done. So it's, as I told, it's not only a cosmetic surgery; it is a reconstructive with a cosmetic angle to it. Of course, nobody is gonna come and tell reduce my breasts any way you wish. So because a breast has to look like one. So even after surgery, it should be aesthetically good looking. That's the whole idea of doing a breast reduction surgery. So you get a youthful, pert, full looking breast, nipples pointing forward and not down, and with lesser weight, of course. So those are the two, three more important questions over there that I had to answer. Okay, how is it done and what is in it for me? Kind of, those are the kind of other questions that I get asked. So breast reduction surgery is a daycare surgery wherein you get admitted in the morning. The surgery takes about 2 to 3 hours depending upon the size of the breast, and by around evening you get discharged. It is not an overnight procedure. You don't have to stay overnight like how maybe you may stay in a tummy tuck or a facelift. You don't have to do that. So get that out of your mind, that breast reduction is a very long affair and things like that. It's a 1 day surgery. So the result also you see the very same day. Of course, that's not the final result. The result keeps improving with time. Say like about 3 months or so, when all the swelling and shrinking has happened and the swelling has gone and the breast settle down and you get a perfect shape to the breast. That is when we say that they are settled, and that is somewhat your final result. So yeah, it's more of a painless affair. I would say it's not a very painful surgery. Painful surgeries, I can say, are like tummy tuck or something like that. Where there's a large scar, there's a large incision that is taken, and it's a transforming surgery in a real sense. So is breast reduction, but in a lesser magnitude of pain and trouble that is caused to you. So if some woman comes to me and asks me, like, doctor, I need a mommy makeover, which surgery do you recommend me to undergo first? I would definitely recommend a breast reduction. If certain parameters fit in place, I might do both together as well. If the reduction is small and the tummy tuck itself is small, the BMI is less, I can see that your recovery potential is good, your social support system is good. Yes, I may combine the surgeries, but primarily I like to limit all cosmetic surgical procedures within the 6 hour bracket. So it is best to do something wholeheartedly in a short span of time, rather than extending it for 6 to 7 hours, prolonging your anesthesia and its anticipated or complications which can occur. You never know. So anesthesia, though modern day anesthesia is very, very safe, that does not mean we should take our chances to burn our fingers. So that is one safety that I always consider in the picture. And so I even get this asked, how do I prepare for my breast reduction in case if I'm coming for one? So what do I do? So we'll be giving you a certain set of blood investigations that need to be done. Your chest X-ray, ECG also needs to be done. What I insist upon mainly is an X-ray mammography or a sonomammography. The difference lies in the fact that younger women will have more dense breast tissue. So that is when X-ray mammography is better, as it can penetrate more deeper and give me a better visual perspective of what lies beneath. Whereas a USG mammography tells me the similar details and can tell me whether there are any occult because see, these large breasts generally can hide a fibroadenoma or fibroadenosis or some cyst within them, and sometimes you may not be able to palpate or to touch them. So it is best to get a sonomammography or an X-ray mammography done to confirm these pre-existing lesions, because during the reduction we can get rid of them for you. Why do you want to keep them when anyway you're undergoing a surgery? So that can definitely be done. And you get a baseline mammogram. Of course, you have to stop smoking. about 1 or 2 weeks before the surgery, and of course 2 to 3 weeks after, because healing is very important. Nicotine is known to cause vasospasm or occlusion of the tiny vessels, so that can compound your result, and you may not get the desired result in the desired time. So definitely that, and avoid taking drugs like aspirin, vitamin E supplements, then anti-inflammatory drugs, ginseng, your excessive garlic intake. All these things lead to increased bleeding, even vitamin E supplements. So these things lead to increased bleeding during surgery. So we do not want that kind of a scenario on table. So we will advise you to go against all these things. Like even the garment, what you come in that day on that day with, should be a front opening one and not a top wearing one. Why? Because after the surgery, I don't expect you to raise your arms, wear the garment and all. It will be really difficult for you. So keeping in mind your comfort and all, definitely we love to make your life comfortable and easy around us, easy around the surgery. So these are all some of the what I can say, preparations that I would say for breast reduction that are necessary. Of course, if there are any fungal infections in the inframammary fold or below the breast, in the axilla and all, that can be taken care of beforehand with the dermatologist's help, to get those in the control, and then we can go ahead with the surgery. This is not an emergency surgery as such. It is, you can definitely schedule it well, looking at your kids' vacations, your vacations, or something, in some social support system around it. So that definitely can be done. And what else? How many cup sizes will I come down? Yeah, that's another interesting question that I get asked. Like generally, those who come, they directly tell me, doctor, just get it as small as you can. Now, sometimes there are limitations. We cannot do that because we need to get the final shape to the breast. A breast is like a hemispherical structure. So to get that structure, you need some volume inside it. You cannot have a hollow breast looking like a hemisphere. So definitely some volume has to remain. Now, whether it is an A cup, B cup, C cup, whatever remains will be decided on table. Because once when we start removing the tissue, only we come to know how this is going to redrape or how this is going to look finally. Of course, we have a mental picture as to how this breast reduction is going to go ahead, and there's no debating that. But on table, we come to know of that fact even better. So be rest assured, you're going to come down 2 or 3 cup sizes. There's no doubt about that. Suppose, because generally women who come to me are generally F or G cups. Okay, and from there, if you have to come down to something like a B or D, it's a C or D. It's a massive transformation. Trust me on this, because you're going to need a wardrobe change. You're going to need a lot of things to change overnight. So that definitely does have a profound significance, even emotionally, mentally, and even physically. So that's one question. Yeah. Then one lady asked me this question: why do my breasts still look large after the surgery? Very pertinent question. That's because there is, when we operate, we of course infiltrate fluid or inject some fluid into the breast so that the blood vessels are, they are taken care of. They don't start bleeding or oozing because we add adrenaline to that. And we do a little bit of liposuction in the armpits so that, your whole silhouette of the upper chest region looks very neat and nice at the end of it. It's not just a breast reduction. It is basically contouring of the upper chest region, so that from any angle you look good. You feel good about yourself. So that liposuction is nowadays a part of breast reduction surgery. Some places we do need it, like in the axilla, in the tail of the breast. So sometimes there is an accessory breast over there. Sometimes there is axillary collection of fat. You have those bulges over there, and for them, mostly women come saying, "I can't wear sleeveless, doctor, because that overhangs and that looks like a double breast or something like that." So that can be taken care of during breast reduction surgery. A lot of these things can be done. So yes, and of course we can combine this surgery with other surgeries, as I mentioned before. Something like maybe you can, go in for a liposuction of the tummy or the thighs or the arms, and generally the breast can be combined together because it's one unit. Even the garment in the post-operative phase can be given that way, such that your arms are covered, your upper back is covered, your bra rolls get liposuctioned out, and so does your breast settle down really well. So that is another thing about breast reduction. Yeah, another question that I am asked always: do I need drains? Well, that's a very subjective question depending upon what size of breast you come with. Suppose if it's an F cup or a G cup, you mostly will need a drain, because see, when we are going to remove a lot of tissue from the breast, cutting the skin and all, there's a lot of dead space inside. Dead space meaning a hollow space, and the body tries to fill this with either fluid from the infiltration or maybe blood sometimes. Definitely not a hematoma. That's not what we expect because we cauterize really well, or achieve hemostasis very well. But yeah, this thing can happen that you can have something like a seroma, that's collection of fluid in that dead space. So to prevent that and to prevent any kind of collection inside, we do put tiny tubes in your inside your breast tissue, and it comes out from the axilla somewhere in the armpit, where like a really hidden tiny spot, and from there we take this fluid out. Normally speaking, for up to 48 hours only, not beyond that. So be rest assured, mostly 2 to 3 days, 2 days maximum that drain is going to last. The moment it comes down below 50 ml in the canister, we remove the drain. So normally after breast reduction, I need to see you 3 times minimum. One, after 48 hours, that is to remove the drains. Two, at the end of 1 week, when I need to change the whole dressing which I've done in the operation theater and give you a fresh set of dressings. And the third is to assess how good the suture line is. Generally, if there are staplers or something like that, or sutures to be removed, that I remove in the second visit, that is after 1 week. And the third visit is just for general assessment, whether you need a dressing further or not, or whether you can leave it open inside the garment or the sports brassiere that you're wearing. So a sports brassiere, generally we like the one with a thicker band which goes around the armpit region, so that it's somewhere here, so that it compresses the chest better. The liposuction area gets compressed better. You get a better finesse and definition of the result, and it also supports the tissues when they're healing. So that all makes a difference. So hence, either the garment, some women are not comfortable with the garment, so either the garment or the sports bra, your choice, wear whatever you wish. We need support and compression over there. Of course, don't wear underwired bras because they can distort the newly reconstructed breast. That can happen. So avoid using an underwired bra. So that answers that question. Why do my breasts still look large after the surgery? Yes, they look large because of the swelling. Give it 2 or 3 weeks time and they will come down. They will shrink. They'll continue to shrink for about 3 months till all the swelling and tissue has gone off, which is supposed to go, and your breast then will, take or settle down, what we say, in a very aesthetic way. So yeah, one more question that was there was, will I need to stay overnight? Well, no, not really. You don't need to stay overnight unless you're combining it with a lot of surgery. Say you are undergoing a 360-degree liposuction, all around the torso, and along with that, you need a breast reduction. Well, then definitely you would be expected to stay at night, because I need to monitor. I need to be sure that you're safe and sound. I can't send you home like that. So that's about that. Yeah, and another very important question what women normally ask me is, how bad are the scars going to be, doctor? Is my breast going to be really scarred and or obnoxiously bad looking or something like that? Definitely not. We are not fools. We are cosmetics plastic surgeons, so we try to keep the scars to the minimum. We don't like giving scars to your body or incisions on your body, so we limit them. So in the breast reduction surgeries that I do, I seldom, or rather very rarely, do go in for the anchor pattern. I generally don't like that because the breasts normally look boxy and flat at the end of it, and we generally don't like the look. They look good on table, they look good for like 3 to 4 weeks after the surgery, but after that, what? You're gonna live with something like a flat boxy breast. We don't like that. Plus the suture line is really long. It's something like it goes from, say, here to here, like that, and for it to heal, it takes more time. So suppose if you have something like the vertical scar reduction surgery, that's what I normally do. So in that, you have got this lollipop incision. I would rather show it on something like this. 1 second. Yeah. Yeah, so if I imagine this is the breast, so you have an incision over here like this around the areola, then you go down from here into the on the undersurface of the breast, and that's it. So this incision is about 6 to 7 centimeters long. When we close it with sutures, it becomes roughly 5 to 6 centimeters maximum, and that shrinks with time, that fades with time. So when you come down for consultations, I can share the pictures with you of the previous patients who have not consented for Instagram usage of their pictures. So those can definitely show you how neat and clean this scar is. Surprisingly, this region scars really well. You don't get keloids, you don't get hypertrophic scars or anything of that sort. It looks really decent, to be very honest. And that is the only scar that you're going to get. There are no other scars. Of course, if you ask me, the drain point scars, they are like barely like 2 small mosquito bites that eventually fade out and go away. So that's not going to bother you in the long term. So those are the scar issues that generally women have, and what are the problems do they have, which they usually ask me. Let me think. I've jotted down a few questions. You can even ask the live questions in the comment section, which is, can you please talk about ptosis surgery? Ptosis, you mean breast ptosis? Yes, ptosis is there. That is why we are doing a breast reduction surgery wherein we lift the breast. Ptosis means hanging, ptotic, sagging down. So we need to lift up the surgery. I mean, we need to lift up the breast tissue. That's what ptosis surgery in breast reduction refers to. The other is eyelid ptosis, which is beyond the scope of this discussion right now. I'll touch upon that topic someday later when I hit that issue. So that's a question which I think I answered. Um, yeah, there is something called pseudotosis also, but which is a little technical term for people to understand right now over here on a YouTube live. So when you come in a consultation, I can explain you better with diagrams and photos as to what pseudotosis or false ptosis is and what true ptosis of the breast is. So the nipple areola also look down. That is when you need a breast reduction surgery so that you lift the whole thing up. So that's that. And yeah, the downtime, the recovery. Yes, I forgot to address that issue. So the recovery is really not that very extensive, to be honest. It generally takes about 2 weeks for you to settle down. So suppose if a client comes to me from abroad and asks me, doctor, how long do I need to stay around here in India? So my answer to you would be around 2 weeks at least. Okay, so that I see that the tissue has started healing and everything is settling in place, you can definitely go back. There's no problem because the suture line, once it starts healing, once we get the look as to this is how it's going to settle, that's it. We don't need to make you wait unnecessarily around us or keep doing dressings just for the heck of it. Definitely not. We don't need to do all that. So yeah, 2 weeks is roughly the downtime. You can start your day-to-day activities by day 2 or day 3. Take a day or two's rest. Take at least 48 hours rest. Definitely not bed rest, but at least rest and relax at home. And after that, you can start doing your day-to-day activities. You can start work from home. You can use your laptop. You can do whatever you wish. That is not a problem. But don't, of course, get into some heavy-duty activities like weightlifting and all. Weightlifting and all you can start doing after about 2 or 3 months, not immediately, definitely. But cardio, yoga, and all you can definitely start after 4 to 6 weeks. No doubt in that. So breast reduction is not a very limiting surgery, unlike a tummy tuck or a facelift or something, which you require more dedication, more downtime, and things like that. Luckily, the region where the breast is not that mobile. In the sense, you move your arms and legs. If you have any surgery done there, it becomes very restricting. But breasts generally do not involve in the mobile region of the body. They are not on the, let's say, a tummy tuck is at the region where the human body bends, and that's why it's more troublesome. But a breast is not like that. Breast, you can definitely the pain quotient will be far less. So that's definitely breast reduction surgery. And yeah, one more question that was there was, what is the difference between the two? What is breast lift and breast reduction? The answer is very simple. In a reduction is a combination of two things. Reduce the size in the sense skin, fat, gland. You reduce all these three, you make the breast smaller, make it into a hemisphere or a globe again, and lift it up. Of course, that's the whole reason why you're doing a reduction, because you want to lift the sagging breast up. Whereas if it is a lift that we are looking for, breast lift is done in patients who do not have a large volume to begin with. They have sagging breast, but they don't have large sagging breast. It is not a heavy breast. So there's a breast which just sags down, which is deflated. Generally happens after pregnancy, lactation, and all, when the breast gland atrophies, which means it becomes smaller because it loses its purpose in life. Like, it has done its job, it has lactated. What more does it want to do? So it involutes, it becomes smaller. So once when that, or even menopause does that. So once when that happens, your skin envelope remains there. It sags down because of the stretch marks and all, and it sags down, and that you have a deflated breast. That breast needs a lift. So during a lift, you can have either the same breast lifted up, or you can augment or enhance the volume by adding an implant called augmentation mastopexy. Masto is breast, pexy is lift. Nothing, no rocket science here, don't worry. So that's augmentation mastopexy with an implant, or you can lift it up and then graft fat at the same go. That's also possible. So you want to take your tummy fat and graft it there, well and good, you can do it, there's no problem. So that's augmentation mastopexy. And the other option is auto augmentation, which means your own breast tissue is reshaped to give you a volume which you like on a little higher scale. Okay, so if the breast is somewhat heavier and it is very lax and sagging, then we can use that volume to increase the size of the breast or to make it look apparently larger. That's all. We are not enlarging the breast. It's the same size somewhat. In fact, we have to remove certain amount of tissue from here and there cleverly so that the skin envelope again redrapes the lifted breast. So that is the difference between a breast lift and a breast reduction. I hope you all got the message over there. I tried to simplify it as much as I can. If not, I can maybe draw a diagram or show and show to you someday next time, because the principle is the same. The incision is the same. Breast lift also can be done, you know, in a periareolar manner. So you have this areola over here, and you just go in and around it. So from there also you can just lift the tissue, and breast lift can be done. But that is for minimally totic breast, like minimally sagging. Agar breast tissue just thoda sa sag ho raha hai, like it's sagging very less, then only you can do this periareolar technique, or else you have to go for a periareolar with a vertical scar over it. If that is done, then definitely you can, like, you know, redrape the breast any way you wish. So all these factors taken into consideration. If you have any doubts in your mind, feel free to ask me in the comment section below. I do answer over there, or you can follow me on Instagram, Dr.Mahesh Nair, and I can answer you there as well. Or you can lift up your phone and give us a call, and we'll answer you even there. So do schedule an appointment if you have any doubts. If you have any queries like whether how young a girl can go in for breast reduction, if she's so bothered about it, I'll be more than happy to help you out, because this is more of a reconstructive and social, you know, stigmatous issue rather than a purely aesthetic one. There's a thin line between both of them in this particular matter. So definitely breast reduction is a very sensitive topic, and I hope I've done justice to this YouTube live session. If there are any more queries, get in touch with me. That's all. Thank you so much for your patient listening. Have a good evening. Bye bye.